Hi, welcome. I'm Dr. Bruce Smoller here at Smoller Smiles and Smoller Institute of Implant Dentistry, where our safety for our family at home, our family in the office, what we call our second family, as well as the family of our patients is the most critical time. We're practicing social distance. We're following the guidelines from the CDC, the ADA, the AGD, the MDA, NIH, and the OSCA and MOUSE. So there's a lot of concern in this country, actually the world, how to stay healthy, how to be healthy, and how to live your life. So it's really a toss-up, and sometimes it's very difficult to really navigate the waters that are changing practically on an hour-by-hour basis. So here at the Smoller Institute of Implant Dentistry, we take everyone's health very seriously. We're under a quarantine as far as a shelter at home. However, essential services are still needed to be done. We've got a very dedicated team who keeps our patients' health and safety the utmost of their concern. So today, with our pandemic goals, we're very limited on what we do as far as seeing patients. We have today Jen, and Jen is here for treatment coming up very soon. And we're going to help her live her life better. We're following the guidelines. We're making sure that we're keeping safe distances, following the protocols for safe workplace, as well as dealing with the pandemic that's present today. So Jen, I know a lot has been going through your mind, and if you could tell us a little bit about your journey as far as what brought you to us, without going into the gory details of your past dental experience. How did you come to find us?
I actually just Googled IV sedation dentist near me. And then the proximity that you are to where I live, I was like, okay, well, there's a plus. And then I don't know. It just, something drew me here. And I was like, okay, well.
It was almost like it was meant to be.
It was. And I was like, well, I'll go and talk to him. If I don't like him, I just won't go with him.
Right.
And then I'm one of those where I'm the whole time, whether it's inside or out, I'm shaking, which is why I'm in the predicament I'm in now, one of the reasons. And I want to say within just a couple minutes of you coming in the room and just talking,
You felt calm and relaxed.
Yeah, I went home, I called my mom and said, Mom, that's never happened before, ever.
Yeah.
And my mom's in the same boat. She's very fearful. She's very apprehensive about dentists. She had been traumatized as a child.
Yeah.
I never had been, so I don't know where my fear comes from.
Right.
But I'm like, I've never just felt at home.
Yeah.
Like, I've known you forever, and like you were like an uncle I was coming to see. I can't really explain it. It was just, it's never happened to me before where I haven't been like, I don't want to go in there.
Now, as far as some of the guidelines, as far as what we had you do, we had taken temperature, we had to rinse, we had, following the time, really limited the access, having patients wait in their car, coming in. I know your past experiences may have been difficult because you're so wound up and scared, but did you notice any differences from your past experiences in dental offices as far as guidelines and OSHA, as far as your experience with us when you came in?
Just the whole not shaking hands, given what's going on now, because I know that would be different if everything were normal.
Right.
You know, the elbow bump and that kind of thing. Yes, I did notice that there was, and I actually kind of liked waiting in the car.
Yeah.
Because, you know, there's always a wait when you go to a doctor.
Well, never with us.
You know, there's always, you got to finish up with the person before you and all that. And I was like, and I always get bored.
Yeah.
So I'm like, well, you're in a waiting room. You don't really want to turn on Netflix because that's disruptive. So I was sitting there watching Netflix until they just came out and got me. And I was just like, I was happy as a clam sitting there.
Good.
And I thought it was actually a really good idea.
Great.
Because my husband was like, well, how are they? Just wait in your car. Like, you're in your own space. And me being as nervous as I am anyway, it was more of a comfort, I think, being in my own space before I was taken out of my comfort zone. So I think that helped as well.
Yeah. So for the procedure that we're going to be doing for you tomorrow, what are you looking forward to?
Just having these monstrosities taken away.
Yeah.
Being able to eat somewhat normally. I mean, I know there's going to be some adjustments I'm going to have to make. I'm going to have to learn how to navigate around the denture and how to eat what I can eat. I'd have no thinking that I'm going to be able to go out and, you know, pop macaroons. I mean, but just being normal, you know, like everything was okay for a little while after I had this done, then it's just not. And I just, you know, no more pain, I think is the biggest thing. No more pain. Being able to just kind of smile again with teeth that actually are the size for my mouth. Because these are too big.
Yeah.
And I've always thought they were too big, but what can you do?
Now, eventually, when we move forward with dental implant treatment, what are the things that you're looking forward to about dental implants?
Just not them just being there.
Yeah.
I guess being in there.
Ability to chew solid foods and not having to worry about shrinking gums or shrinking bone.
Yeah, that was a good thing. You know, big thing was the deterioration, because I know my mom has had some issues with deterioration.
Right.
She has like the pegs for her bottom teeth, and she's had like skin grow up over them, where they had to go and
do things.
Yeah, do things, which for her you don't want to do things.
Right. Well, the thing that we're looking forward to, we're actually going to be doing a procedure where we're actually going to be drawing some blood. We put in a little centrifuge. We draw out the blood proteins from your platelets that are actually going to help with bone growth. So the PRGF is very similar to some of the other procedures out there, PRF, LPRF, and it allows the procedure to heal much better, the bone to stay as healthy as possible. For patients with implants, with dentures, having a more solid foundation can only be a good thing for you. So we're really excited for that. I think it's going to be, now that you're sort of at the top of the roller coaster ride.
Tomorrow it's going to come all down and I'll be all right.
Yeah.
Because I'm not nervous about doing, I'm just, you know, nervous. It's anesthesia. It's surgery, and so there's that nerves that you get when anybody goes in. I had major surgery, and I felt the same way right before that too. Just kind of, but I just know it's going to be so much better than before. It's like it's going to be seconds for me. Yeah. And then I'll wake up, and it'll be done, and I'll be done, and then hopefully, I don't know. It's going to be a few years or so. I'm sure, you know, we can move on to the implants, and that kind of stuff. But I'm just like.
So the nice thing is, if one of us has to be nervous or anxious, it's much better that it's you than me.
And it's, like I said before, me being asleep is a lot easier on you. I flinch, I whine, I wince. Yeah. Whether I feel anything or not, I'm holding onto the side of the thing like this. I mean, it's so much easier for me.
We've had bigger and stronger people than you, and our chairs haven't broken.
They probably come to their knees.
So that's not a challenge, but we're very happy, Jen, that you're here. We're very happy that you found us. It's amazing how many people, it's almost like a magnet that draws people in to us.
It is. It's so weird. And it's like, well, I was telling my husband, I said, you know what? I think if I had found you guys years ago, I wouldn't be in the predicament I'm in now. Yeah. Because I wouldn't, part of my issue was financial. I was on Medicaid, and there's only a certain you can do, and there's only a certain amount they will do. Right. And then I had the fear. Yeah. So it was like all that together. It's that I think I'd probably be in a much better position had I had found you years ago than I am in now.
Well, like that one song, when I do lecturing and presentations across the country, I quote songs, and there's this one song by Cher, and she's been around for a while.
I don't know who that
is. She has a song that says, if you could turn back time. Yep. So if we could turn back time, that would be a wonderful thing. But we're here today in the new normal of 2020, of COVID and coronavirus. So we're very happy that we're able to keep people healthy. We can keep people out of pain. You've been suffering for how many years?
Let's see. I did have some work done at one point, and that helped. I want to say a good 2 years that everything started to go back down again, and then about a month or so ago I started getting the zip, and that's I'm one of those that I wait till something hurts. Yeah. And then, which the antibiotics really kind of helped with that too. Right. It helped kind of minimize that. Yeah. It's still zinging a little bit, but I'm not like going to my knees anymore like I was.
Right.
I'm like, oh.
Yeah.
So.
Well, only one more day.
One more day.
So we're going to be able to see Jen back soon, and we're looking forward to it. So
Yes.
hopefully life is going to continue where we're going to be making progress, flattening that curve, protecting ourselves and protecting the people around you with safe distancing. So we really appreciate your time, and the message we want to get out there is we have digital dentistry. It's telemedicine these days, so people will connect with us remotely. We're not open for everyone to come on in right now, but in select cases, we want to help people still live. So essential, urgent services, emergencies that end up in the hospital or the emergency rooms are exactly what we want to prevent.
Right.
Infections in the mouth that spread through the body can be life-threatening.
Yep, they can be.
So thank you so much for your time, and looking forward to tomorrow.
Me too.
Yay.
Me too. I'm looking forward to about this time.
Awesome.
I'll be all right.
Great. Well, thank you so much.
No problem.
Yeah.
It's like I was thinking it was kind of funny. I'll have these pretty new teeth, but nowhere to go.
Well, that would have been a good line.
Oh.
Do you want to do that one?
Yes.
Yeah.
We'll end it with it. Hold on. Go ahead.
All right. I'll have pretty new teeth, but nowhere to go.
That's great. So, Suzanne, what we'll end up doing is some of the other things that will be like the PSA announcements.
Mm-hmm.
We're actually forming a campaign where we're going to be promoting healthy visits, the telemedicine, the telehealth, and I talk to colleagues all the time in my network, and overwhelmingly out of every 100 dental offices in Michigan, 99 of them are closed.
Mm-hmm.
They don't even have their answering machine on. I talked to a person right next to my Rochester Hills office. She said, I don't even know if we can even open in May.
Gosh.
Can you imagine?
My mom goes to Dr. John out there.
Oh, really?
Yeah.
And if you're in pain and suffering,
Right.
how can you wait months?
Well, there was something, I was reading something on Facebook about them wanting to close the dentist's office. And my comment was, let's let the professionals decide what's essential and what isn't.
Right.
Because, I mean, granted, what's essential to me may not be essential to somebody else, but let you decide that. Because you're the professional, you went to school for this, you get paid the big bucks for this.
Oh, yeah.
Who am I to say that Susie's problem isn't important enough?
Right.
You know?
Do you want to turn this on? Is it?
It's still here.
So, I'm like, just leave this up to the professionals. Let them contact them, talk to them, let them, let me tell you what's going on, and then you can decide, all right, is this something that she needs to come in now for? Is this something that I can call in an antibiotic and a Motrin for and get her stable until we can open back up for everything? It's like, stop making decisions that you're not qualified to make decisions for.
And that's exactly right, because there's patients that need help now.
Right.
It should be offered. There's patients that may want the help now, but it's not essential.
Right. It's like my husband has a fractured tooth, and he had to go and, I don't know, they did a mold or something, and the jelly stuff they put up in there that came out.
Yeah.
So he's hurting a little bit.
Yeah.
Well, he's like, I can wait.
Right.
So like something like that, if he says he can wait, then okay, then you can wait. I told him I think you should call and get an antibiotic just in case, but.
And he can be evaluated. So one of the problems is that there can be an infection that doesn't show up in the patient's mouth.
Right.
And there are patients at risk if there's heart disease, kidney disease, lung disease. Infections in the mouth will make diabetics have more problems.
Right. I mean, because it's in your mouth doesn't mean it won't go to your entire body, and then it turns septic, and then you end up. My mom ended up in the hospital. So there was something going on that they didn't know, and she ended up in the hospital. And when she had that post, her gum was kind of like growing up over the post, and she went to a regular dentist. She went to Dr. Now I can't remember his name.
It's good not to say.
And she had gone to him for 30 some odd years. He had said, all right. He goes, last time we tried to treat an infection, he's like, no, I'm sending you back to Dr. Joe. I'm sending you back there because, and he got her straightened back up.
Right.
They're way out in Oakland County.
Yeah.
But, he, they weren't gonna mess with it again because my
Yeah.
mom gets infections so easily.
Yeah.
She's
Issues.
a lightweight.
Yeah. Well, thank you so much, Jen.
Yep, thank you.
Okay.
I'm excited.
Yeah.